Welcome to the Birth Journeys podcast. I'm your host, Kelly Hoff, BSN RN. I am a wife, a mother of two, and a nurse specializing in the care of women and newborns. In this podcast, we will share powerful journeys of birth givers with the goals of lifting the veil on the birth experience, healing through sharing, and beginning an open conversation to strengthen trust and promote transparency between birthing people and healthcare providers. Hello. Today I have with me Dr. Betel Aklilu. Dr. Aklilu is a doctor of chiropractic medicine and the owner of Chiropractic. She is certified in Webster technique, which is beneficial for pregnancy, and she is certified to care for babies and children as well. Today she is here to talk about how she helps kids, starting with newborns and up. Dr. Aklilu, welcome and thank you for joining me.
Thank you so much for having me, Kelly. I'm very honored to be here today.
I am so curious about what you have to say. I remember I took my daughter to a chiropractor. I don't even remember what it was for. I've taken her a couple times, I think. But my husband was like, what are you going to do? Are they going to hang her upside down by her ankles? So I really hope that most people don't think that, but I know that's not what it is about. And it's very gentle. And I know there's a lot of benefits, and I probably don't know even the half of it. So I am really excited to sit back and listen to what you have to say.
You know, it's interesting. Most people don't find a pediatric chiropractor or find out about pediatric chiropractic care until they're frustrated about something. You know, I've Googled this time and time again, and somewhat it just keeps coming up. And I think maybe because XYZ hasn't worked, maybe I'll try the chiropractor. So it's kind of, for many, not for all, an option of last resort. So I love that we get to do this today so we can introduce pediatric chiropractic care to the world again and don't know about it. But the number one thing that I want everyone to walk away with is an understanding that chiropractic care is very safe and very gentle. And the earlier you begin getting chiropractic care, meaning getting care for your spine and for your joints and for your muscles, the better.
My biggest thing is allopathic medicine is problem-based. And so that's what we're accustomed to. And what we really should be doing is getting into the habit of preventing disease. And so my understanding of chiropractic medicine is to prevent disease and maintain health.
Right.
Is that correct?
Yes. So you hit it. So allopathic medicine is about pathogenesis. It's something is wrong. How do we fix it? As opposed to how we look at things from a salutogenic model, meaning how do we keep a system well? How do we nurture things continuing to work? Not necessarily fix something that's broken. So where we look at from a chiropractic lens for pediatrics is, okay, this is a newborn, but this newborn just experienced trauma. So in the womb, we're in all sorts of funky positions. Your head may be tilted back, maybe upside down, or however, right? Different positions in the womb in this confined small space. Then we experience birth, and that could be through the vaginal canal, or it's a cesarean birth. However we come into the world, there's some level of trauma that's associated with it. Now, because of that, what we're doing as pediatric chiropractors are looking at the skeletal structure. We're looking at the muscles. We're looking at the joints, and we're looking at tissue tension throughout the body and saying, hey, has this been a little locked up? Does this need a little bit of moving? Do we need help with extending in an area? So a lot of it is just inducing and helping create movement in areas that maybe this newborn baby doesn't know how to do yet. So it's really about that. And in that process, we help peel off some of those layers of trauma. We peel off some of those layers of maybe some tension that may be happening. And so we're looking at, okay, let's just help this baby have the best chance in optimizing and allowing the nerves and the muscles and the nervous system to work at its best. So not necessarily trying to fix something, but just make sure it's doing well.
Right. And I mean, to elaborate that, since I see birth happen every day, the things that we know physiologically occur when you're being born, specifically if it's a vaginal birth. I'll start with that. I mean, the baby's head is going to get squished. Those bones in the skull are not fused. And so they are created to be malleable, and one can pass over the other.
Okay.
We see babies, if they've been sitting in, like, while the cervix is dilating, if they're sitting in the pelvis for a long period of time, you get swelling in the skull that has to go down as those bones go back to, or hopefully go back to where they're supposed to. There is smushing of all, because babies basically are cartilage when they come out. They're like little bowls of jello that slide out. They're just this gelatinous creature that comes out that has to solidify eventually. There's so much that goes on, especially if the births that I see, the head comes out, the shoulders are next. There's depending on the provider, slight tension that they put on the head as they pull and maneuver the baby out. Depending on the position of the arms, there could be trauma there. It is not an easy process for the baby, and I think people discount that a lot. Neither is it with a C-section. Imagine a baby that's been breech.
Right.
I see babies come out, their legs are just literally straight up near their ears.
Right.
And then when they try to put them down, they're stiff. They can't bend their knees correctly. There's so many things that I see that probably, I mean, we don't treat them, we don't treat them at the hospital unless it's something that is surgical or that we can give medication for. We're not exactly doing any chiropractic care or massage for the newborns. So how do we fix all that?
So in my ideal world, people like myself would be in hospitals where birth is taking place, or in birthing centers, wherever have you. Because as soon as we can get to these babies and help to ease the tension in those areas, like you said, we're not breaking children. In fact, it's very hard to break a baby. It's a lot of cartilage, and as soft and gentle and fragile as we may think they are, they're actually very strong. And they've endured so much. And so those times right there, that's crucial. It's crucial. I know for me, for my nephew, I adjusted him within 24 hours. And I know the difference that made, because he was able to sleep better and to nurse better and to just do better, because I was quick to address some of the things that I was seeing early on. And every time something would come up with the pediatrician, it was quick to, all right, let's get some movement. Let's start some exercises. Let's do these things. So we weren't trying to necessarily fix something always. We're just making sure that he's doing well on a day-to-day basis. A lot of people don't know that. And if you don't know that because your doctors aren't telling you, because they most likely don't know.
That is correct. That is not taught in medical school.
Well, it's this concept, but again, it's super gentle. It's, for me as a practitioner, fun and joyful, because like you described, some of these babies have had their feet by their ears for months, or they're born and the bones, right? The cranial bones that have slid over one another, they haven't necessarily come back apart the way that they should. So that's changed the shape of their head, and it's changed how their jaw and their jaw movements, their tongue movements, their neck movements. And so they're not comfortable. Have no way to express that other than to maybe not latch or be fussy or have gas or colic, or sometimes just not sleep through the night, whatever have you. And unfortunately, because we're not accustomed to chiropractic care so early on, some of these things go on for longer than they should. And it's passed off as, oh, that's just a newborn. All babies cry. Some babies latch. Some babies are just constipated. Things like that. We're starting to mistake what's common for what's normal.
Yeah, I wish that there were chiropractors at hospitals, and I wish that all insurance covered chiropractic care. And it's been, depending on my insurance, it's like, how do I budget for my chiropractic care? I know my chiropractor in New York, my chiropractor did see babies. I know that he would make hospital calls. Yeah, they should be in the hospitals.
Well, to that point, if we had this let's not just call it chiropractic care, right? Let's call it wellness.
Mm-hmm.
And if we were doing wellness care
Mm-hmm.
and taking care of our bodies in these times when you're pregnant or when you're just born and have just experienced your first trauma,
Mm-hmm.
I mean, leaps and bounds.
Yeah.
We would fix so many different things to the point where I couldn't even list them, right?
Yeah.
Some things we only know to be problems because we just were never really well to begin with. You have a baby that's struggling with torticollis, had problems with latching, and we just kind of do other things rather than truly get to the foundation of that. Later on, that's changing how the baby looks and perceives the world, how the baby feeds, speaks, moves. It's our entire foundation that's being based off of something that we potentially, not to say that, we do this one thing and it's a miracle. It could absolutely be that. It could also just be just giving a child the full advantage of being able to have a restful nervous system and grow with a solid foundation,
Yeah.
I just think of how many moms and babies would benefit from that type of attention and touch and care. It's truly love.
Absolutely. I remember when my daughter was having some issues with fluid in her ears, and I took her to the chiropractor, and I think it was I definitely should have taken her sooner. I just wasn't sure how she was going to respond. The pressure on I believe it's the mastoid process, she really hated it. And probably because it was so irritated by then and so inflamed by then, because she had constant fluid in her ears. I really wish that I had done that sooner.
That atlas goes off, and that's really the key. Like in Webster, there's a key part of the Webster technique that I think does 80-90% of it. And for children, creating the relief. And for children, it's really in that upper cervical region and making sure that we've created relief in any tension in the cranial bones or in the cervical region. And then that really, that's a game changer. That's a game changer. But it allows the fluid in your ear to flow better. It allows your tongue to move better. Just drainage from your sinus cavities, all of that. Feeding, swallowing, gags, all of it.
Wow. That is hugely important because I know so many kids have issues with the sinus drainage in the ear because when they're babies, a lot of people don't know this, their eustachian tubes are horizontal. And as they grow, they start to move in a more diagonal way. And so it is very, very common for kids to have fluid behind their ears, which it's uncomfortable. And so it's really important to help them with that drainage. And so, if that's not an argument in itself to go to a chiropractor to help them with that drainage, because it is going to happen physiologically to every single baby. That's just the way that they're made. And I don't remember, is it age 4 when they start to stretch and move more in a diagonal?
Oh, I don't know the exact age.
Yeah.
That's a great question, though.
I think it was 4 because that was about the time that they were like, well, by then you probably wouldn't need ear tubes because my daughter ended up getting ear tubes.
Many parents seek chiropractic care.
Yeah.
That happens to be one of the bigger reasons to seek out a chiropractor because they don't want to have surgery. So that and colic.
Yes.
Colic is a huge one because it's from the allopathic stance. There's nothing to be done. There's no reason for it. There's nothing we can do for it either. And it is devastating for a parent.
Yeah.
Can't seem to get their child to rest, to be comfortable, and to stop crying. It's heartbreaking.
Yeah, because if the baby's not resting,
nobody's resting. Nobody's resting.
Yeah, I've been there. That's frustrating. Just thinking of my own experience, my daughter, we moved here from New York when she was like 4.5 months. And as you can imagine, it was a drive. She was in the car seat for a long time. There were definitely, it disrupted her sleep. And it didn't occur to me that maybe the car seat ride had something to do with it. I just assumed that it was the environment, which probably, a new environment does have something to do with it. But can you speak a little bit about, keep your kids in car seats for sure. But I know that car seats can help and hinder alignment depending on a lot of things.
Yeah, I love that you brought that up because a lot of people do come to me for my baby doesn't like the car seat. And because it's now, I can't get from point A to point B. We can't make it to appointments without baby crying. All these different things. Parents are trying to figure out what's going on with this car seat. So what I find a lot of times with my babies and who are crying in the car seat, it's the position that their back is in, and they typically have a subluxation or dysfunction, something for us as chiropractors to correct in that area where the thoracic spine meets the lumbar spine. And it's just this very uncomfortable seated position that babies get in and can't really extend and can't really get themselves comfortable. And it's going to, like adults, pushes on your belly, pushes on your diaphragm. You can't breathe as well. Babies don't know what's going on. So there's all of that. So it can lead to lots of different things. In some cases, with older children, I've seen it's the motion of the car and it making them really nauseous. And with that, I found that cervical adjustments have been a huge
Really?
Yes. So with getting car sick and things, that's been really very, very helpful. So the car seat, you have to be safe. You have to be in a car seat. Sometimes I look at the car seat and we talk about different ways to maybe pad the back of the seat in those areas where babies maybe have some more tension. But oftentimes with adjustments that's also no longer a concern. And that doesn't take long. Sometimes it's one or two adjustments. And just to talk a little bit about the adjustments themselves, the motion, the movement that we're putting into a baby is very light. So oftentimes I have parents kind of put their hands over mine so they can see the force that I'm putting in. Sometimes I explain to them, like, I actually have to put in some level of a force here, or we're not going to get the adjustment that we want to receive. And then in some cases, people, have the perception, oh, it's going to be too rough. It's going to be too much. Actually, most of the time, if a baby is distracted, they are completely unaware that anything even happened, So there is that too. So it's a matter of really helping parents to feel empowered. Before I adjust, I have parents hold their baby, kind of feel how their baby weighs, right? And then I'll adjust the baby and say, okay, hold your baby again. And often, almost 100% of the time, the baby feels lighter. And it's like anyone else, right? When you're holding a bunch of tension, you're just holding, you feel heavier. And when that tension starts to go away, you feel lighter. And that has been, I think, beyond anything else I've done in the office, from the first time adjustment, parents go, okay, that's where they see it. And they go, okay, so I'm not making it up in my mind that my baby likes this. Because I have some parents that say to me, Dr. A, my friends make fun of me all the time because they're like, you take your kid to the chiropractor? Really?
Oh, bougie.
But it's true. Once you understand that it's a need, and that's one of the myths of chiropractic, right? This idea of, oh, if you go now, if you start going, you're going to have to go for the rest of your life.
First of all, not true. Second of all, why is that a bad thing?
Thank you.
I'm going to go for the rest of my life.
But we also are bodies who need care, right?
Right.
We sit and we jump and we eat and we experience lots of different things. And some people go to the chiropractor because it helps them with their anxiety. For some, it helps with their depression. For some, it helps with their constipation. For some, it helps with their back pain and neck pain and shoulder pain. We're going to the chiropractor for different things. For some, it's a nervous system thing, right? Are we stuck in fight or flight? We're so tense all the time. This helps me and helps my body relax. It helps me sleep. Or it just helps my body because I don't do good things with my body. I lift heavy weights, or I work on cars, or whatever have you, right? Or I'm
deliver babies,
fixing teeth, whatever have you. So why not think about your wellness early on? Why not teach our children and our babies to take care of themselves?
Yeah, absolutely. I usually recommend to all moms when they're about to deliver or they're pregnant to go to the chiropractor because I just feel like it is so much more helpful. I don't get as much buy-in with the taking the babies, but I do mention it. But now I have something to back me up.
Yes. And it's interesting to me, and I don't fault anyone because at the end of the day, you do the best you can with the information that you have. Being a parent is hard enough, you know?
Yeah.
And I'm not a parent, so I'm definitely not going to put my opinion on one way or another. However, I'm just trying to take care of my dogs. So there's that.
You adjust your dogs?
I do. Whether I should or not, that's.
We should do an episode on canine adjustment.
Yeah.
Yeah.
That's the whole thing. But for me, knowing what I know, because I've studied what I've studied, and because I've seen so many births and birthing people and their experiences and so many babies, I would never have a baby not get adjusted if that was an option, right?
Right. Yeah.
Because of that. But I do understand for those who are listening who have never been adjusted themselves, can't even fathom the idea of a child being adjusted, really do think about finding a safe space, finding a provider you feel most comfortable with so you can share what some of these fears are, and maybe just tiptoeing and walking through what this looks like. Just because we don't know it or because we're scared, it doesn't mean that we shouldn't. Right. We shouldn't have to miss out. And really, babies shouldn't. I think in my perfect world, every child should have the opportunity to be adjusted.
Yeah, absolutely. And I say that completely agreeing with you, and probably having neglected doing that to my own kids. I only took my daughter twice.
Even one time can change everything.
Well, that's good to know.
Yes.
You're reminding me that maybe I should. My son he's 4. He has motion sickness, and I've noticed he doesn't have ear pain, but I've noticed his drainage is not good. And so I'm wondering if he does have something going on in his cervical spine. And there's 2 other things that came up for me when you were saying all that. First of all, you mentioned babies that are difficult to latch. There are some soft tissue issues that I've noticed are the problem. And those are things that as a nurse and working with lactation consultants, we can kind of see, like a tongue tie or lip tie. But there's other things that I think I remember that we don't deal with or even acknowledge. Is there stuff that goes on with like the palate?
Absolutely.
Can you talk about that? Because there's other reasons that we can't fix necessarily with allopathic medicine that could be a problem with the latch.
Right. So just to speak on tongue ties and lip ties. So pediatric chiropractors work hand in hand with pediatric dentists and ENTs. So it's all the same anatomy, and it's different tools for how you get to an endpoint. So I've had babies with tongue ties that are latching well and moving well, and dentists have said, hey, we don't have to make a surgical correction in this case if you're comfortable with where things are. I've had many cases too, where parents are, hey, I'm more comfortable with having this release performed, and I would like the care before and after with chiropractic to give me a whole well-rounded care for what's going on. Because even after a release, a tongue-tie release, there is that potential of it reattaching. So we need to keep the exercises moving so that the tongue continues to move, and chiropractic care is so imperative during that time because it's helping exactly the soft tissue. So I do a lot of work when it comes to that. And I tell parents, some pediatric chiropractors will definitely say to you, or may say to you, I can't speak for anyone else, may say to you, no, don't have this release done. Or maybe we'll say, do have this release done. For me, it's you're the parent. So we're going to get all of this information. I'm going to give it to you. They're going to give it to you. And together we can make a decision. We can help you to come to a decision that's best for you and for your family and for your child, right? The palate is when we're doing cranial adjustments. And remember, we talked about like you mentioned, how the bones go over one another so that the baby can come out of the vaginal space. Well, once we're releasing the tension there, that same thing is happening to the palate. It's
because it's all pressure. It's all connected.
It's all pressure. It's all connected. And it's literally the bottom of the cranium.
Mm-hmm.
So we can go in there and use our thumbs to help to widen out that space. Pressure points there are very, very important. In addition to just massaging parts of the temple and the jaw, underneath the jaw, all of those different things in the back of the head, back of the neck. So lots of different things that we can do from a soft tissue standpoint. And these are things that I can show parents. This is what I'm doing. It's not
mysterious.
It's not
a clandestine thing that you're doing.
I want to empower this parent so when they're at home and they're reading a bedtime story and the baby's not in an office where they're not most comfortable, right? They can do some of these things and they can feel some of this tension and really be present with what's going on. I think that's really helpful.
Are you pregnant and planning a hospital birth? You don't need a birth plan. You need a birth vision. In my opinion, birth plans set you up for failure. Yep, I said it. Hear me out before you turn off this podcast. You may think that by downloading a generic birth plan, it means you're in control. The truth is, it's not that simple. No one can control exactly how their birth will go. There are way too many variables. What every pregnant person wants is to walk into the hospital pregnant and to walk out with a healthy newborn in their arms. The journey in between is the murky part. It's hard to know what issues might come up that need to be addressed. If you focus your energy on a birth vision rather than giving your power to a birth plan, you can empower yourself to make the best choices for you and your baby. That's why you need to get into my Empowered Hospital Birth program. As a labor nurse and mindset coach, I can help guide you through the process of maintaining the calm autonomy that will help you achieve the birth vision you desire. In my Empowered Hospital Birth program, I will help you identify the source of anxiety you have surrounding hospital birth, fill in knowledge gaps to make sure that you are fully informed and confident, learn key phrases so you can better communicate with your medical team, emotionally process your fears so that they don't hold power over you. Go to kellyhoff.com/empowered to book a free 30-minute private birth vision call, where we will identify your top fears and must-haves and gain clarity on exactly how you want to feel in the birth space. That's KELLYHOF.com/empowered. I'm honored to be a part of your birth journey.
Yeah, you've touched on colic, you've touched on latching, you've touched on the bones in the head.
Often we have restrictions in the head, in the neck, in the jaw, in the face. You have restrictions also in the pelvic space, and that can lead to just being uncomfortable, one in a car seat, right? Or any of these swings that we put babies in, and also not being able to pass gas easily, being more constipated, and they're uncomfortable. They don't know how to tell you right here hurts, but it got squished in that process. And when we hold babies, we squish them even more.
Yep.
And we swaddle them and we put them together like a little bundle, and we're not eliciting enough movement. Really, the key to all of this for everyone is movement is life.
Yes.
So when we move, we are living. And when we move, our joints are flourishing. They're staying mobile. They're staying well nourished, right? And when we're not moving, our system starts to get stuck.
Mm-hmm.
And things can't release. And we become a little bit more stiff and all of those different things. And then it makes you think, because most parents think there's nothing wrong with my kid. My kid is perfect. My kid is happy, smiling, slept well today, all of those different things. It's harder for parents to pick up on, or to maybe acknowledge, maybe he does look to the right more than he does to the left.
Mm-hmm.
Yeah. Maybe when he yawns, maybe there is a deviation to his jaw. Maybe. I mean, really, like who's perfectly symmetrical?
Nobody.
So these kind of things, when I sit down with a parent and say, okay, let's just take a look, right? That's when they start to open up their eyes, because often they've gone to the pediatrician time and time again, and they're being told, oh, everything's okay. this is good, this is fine, everything's okay. And no one's really assessing for the things that I'm looking for.
Some other things that come up for me is like hips. You know, you mentioned swaddle.
Oh, yeah.
That's a big thing. I swaddle the top. I don't swaddle the bottom.
Really? Love it. Okay.
Yeah.
Okay.
Babies need to be able to move those hips. And if they want their arms, I mean, they can get their arms out.
Right.
If they want to.
Right. And I think that the reason behind the swaddle, like, correct me if I'm wrong, was really because of the startle reflex. And because we just want babies to be able to sleep without startling themselves and waking themselves. But it can't come at the cost of your baby's joints, right?
Yeah.
So I love that. You know, everyone's going to do something a little differently. But now what I've seen as of late is all of my breached babies, no matter what, even if they were just breached for just a short period of time, they get ultrasounds of their hips.
Yeah.
Right?
Yeah, I'm noticing that a lot.
I'm noticing that. And it's interesting because, you know, they were born completely fine, you know, vaginal birth, head down and everything. But it's interesting to me that that's happening. And I wonder why. Why are we doing that rather than just doing an exam on the hip? And I do a hip exam and everything is fine. I don't think that the ultrasound is necessary. Now, most of my parents get the ultrasound anyway, and that's fine too, right? But I think that there is somewhere deep down in here a push for, okay, we know something's up, we just don't know what to do or where to, where to send these babies just to make sure everything's okay. But now more and more, I have my parents just kind of say, hey, you know, I take my baby to the pediatric chiropractor. She checked the hips, but sure, if you think that ultrasound, let's do that.
Well, I mean, there would be maybe a little bit of retrospective
studies
for those that, I mean, maybe they should note who has been going to the chiropractor and who is, you know, we could be able to go back and like do some research on, babies that go to the chiropractor don't need interventions. That's just my hypothesis.
I'm loving it. Yeah, you know, I would love to. I ask all the time when I have a pediatrician who doesn't think so favorably of pediatric chiropractic care or seeing a pediatric chiropractor and the parents are coming to me anyways, I ask them to just gently ask. Maybe not, you don't need to badger with questions, but say like, where does this thought come from? Is it a personal perspective or are there studies? Is there something that's saying to you, there's a reason not to? And in all of my years so far, I was very recently introduced to this idea that maybe from the allopathic stance, babies or children shouldn't see a chiropractor until they're 12. Now,
that's too late.
You know, I believe that the idea is that their growth plates are formed. And, you know, I won't even go further into that. I'll say that before babies or children are 12 years old, we're exposing them to lots of different things, sports, gymnastics, ballet.
All the things that make the joints go crazy.
Exactly. So we can do all of those things. Where is the logic that getting some care for your body should wait?
You would send someone to a physical therapist if they damage the soft tissue.
Correct. And physical therapy is where pediatricians would recommend and send their children, which is awesome because physical therapists are needed and they're great.
Right.
I think that some of this is really more political and historical than it should be. But
here we are.
Here we are.
Well, and the thing is, my argument is always like, yes, you can go see a physical therapist also.
Absolutely.
But let's consider the fact that if you're going to be exercising your body on something that is misaligned,
Kelly,
where is the physics in that? I've never understood why chiropractors are so maligned. That has just always baffled me. And just to say, I mean, I know, so my dad's a surgeon and he was like, don't let them adjust your neck. Well, that's not fully true either. Now, if you're uncomfortable with something that happens, and just this is a little bit of a tangent because we're supposed to be talking about kids, adjusting the neck in kids is completely different than adjusting the neck in adults. But there are a lot of options that don't involve twisting your head.
Right.
And I'm not going to comment on whether or not getting your head twisted is bad or good, because I've had it done. But if you're uncomfortable with that, there's other options. So just to dispel the whole body popper head twister hanging by the feet, that's not what chiropractors do 95% of the time.
Correct. Not at all. Especially not with babies.
Oh, of course, not with babies. And additionally, I mean, I think if I remember right, you have videos on Instagram, at least. Do you also have YouTube?
I don't, but soon with my nephew, we will be making YouTube videos. So that will be coming.
Awesome. Yeah. So if anyone's curious about what it is that chiropractors do with babies and children, your Instagram, now remind me of your Instagram handle because I forgot to write it down.
It's Kalai_Chiro Wellness.
So you can go to her Instagram. I'm going to put it in the show notes. I'm also going to have your website in the show notes. So if you're curious, but not quite sure if you should go see a pediatric chiropractor. And now I know, I mean, you're based in Virginia. Not everybody in the world is going to be coming to Northern Virginia to find you. But you can also look for chiropractors that are pediatric chiropractors if you would like your child to be evaluated. So it's not, they're all over.
All over.
And you can learn before you go. You can share with your pediatrician some of the videos so that they can understand what's going on and the logic. And if we all just start having an open conversation about the benefits and trying to understand instead of having this closed perspective where, oh no, that's bad, that's not the norm, maybe we can prevent some things before they happen.
Yes.
Well, Dr. Aklilu, is there anything we didn't touch on that you wanted to talk about?
No, I think that that was beautiful. It was beautiful.
Yeah, I know you could probably talk all day about it, and I'm pretty sure I could too. But you've definitely opened my eyes to some other things that I didn't know about and motivated me to maybe, since we're getting to the end of the year and we've already hit our out-of-pocket max, maybe it's time to get my kids to the chiropractor again.
There you go.
And insurance companies, cover chiropractic care. Do a better job.
Do a better job. Do a job of covering wellness. Because keep people well, maybe they won't get sick.
Yes. All of that. All right. Well, Dr. Aklilu, I really enjoyed this episode. I am really excited for my listeners to hear about pediatric chiropractic medicine and incorporate that into their care of their newborns and their children.
Thank you.
Thank you so much. Thank you so much for tuning into my podcast. If you enjoyed what you heard, make sure you hit that subscribe button so you don't miss out on future episodes. Don't forget to share the podcast with a friend who can benefit from the valuable insights that we share here. And if you could take a moment to leave a 5-star rating and review, it would mean the world to me. If you're ready to work one-on-one with me to embark on a transformational journey towards a confident and empowered hospital birth experience, go to kellyhoff.com/empowered and enroll in my Empowered Hospital Birth Coaching Program. Together, we'll create a roadmap to a birth experience that you'll cherish forever. That's KELLYHOF.com/empowered. Let's make your birth experience extraordinary.